Hello, my name is Jacqueline, and I'm going to be presenting about a case we saw about fulminant Hashimoto thyroiditis after COVID-19 infection. So there is very little that we know about this full spectrum of effects of COVID-19 regarding the autoimmune and more specifically endocrinological diseases. Since its outbreak in 2019, there have been several associations that have been described between the virus and systemic manifestations such as Guillain-Barré syndrome, subacute thyroiditis, and pediatric multisystemic inflammatory syndrome. So in this report, we describe a case of fulminant Hashimoto thyroiditis with profound thyroid failure developed shortly after COVID-19 infection. So why is this case significant? COVID-19 is a novel virus, and few reports have been published about the effect of this virus on the thyroid. No cases so far have been published about the development of profound hypothyroidism, secondary to Hashimoto's thyroiditis after COVID-19 infection. Understanding the relationship between COVID-19 and thyroid diseases opens the door for more research to study the mechanism by which COVID-19 can affect the thyroid. And given the autoimmune nature of Hashimoto thyroiditis, it would open the door for more research into the mechanism of how COVID-19 can cause autoimmune diseases. So regarding the case, this is the previously healthy 38-year-old woman, 6 months postpartum. She tested positive for COVID-19. She had symptoms of sore throat, dry cough, loss of sense of smell and taste. And she did not require any hospitalization. She received symptomatic treatment at home, and the test remained positive for 4 weeks. Around 6 weeks after the infection, the patient started developing throat discomfort, along with thyroid enlargement, and she had compressive symptoms and worsening of fatigue, depression, myalgias. Her labs were significant for a TSH of 136, free T4 of 0.2, which is low, and antithyroid peroxidase antibody of more than 900. The normal is less than 9. And antithyroglobulin antibodies of more than 1,000. So the patient started full-dose thyroid hormone replacement with levothyroxine. And serial free T4 levels were reviewed after treatment, and it showed adequate response with normalization of free T4 levels at 4 weeks, along with clinical improvement. And then on thyroid ultrasound, we saw diffuse heterogeneous appearance of the thyroid along with marked hypoechoic echo texture consistent with autoimmune thyroiditis. And we have the images here, and from the ultrasound report it was written prominent and hyperemic thyroid gland could represent underlying thyroiditis. The patient also underwent a fine needle aspiration, and we saw the aspiration involved the left thyroid lobe, and it showed hypocellularity with mixed inflammatory cells, histiocytes with epithelioid morphology, and granulomatous inflammation, but no significant lymphocytic infiltration. So basically, the association between COVID-19 and various autoimmune diseases affecting the thyroid and other systems is still a subject of ongoing investigation. So, given the recent COVID-19 infection in our patient and the profound hypothyroidism, 6 weeks later, this raised the question of a possible association between COVID-19 and Hashimoto's thyroiditis. So, the delayed autoimmune thyroid presentation may be related to activation of T and B cell immunity by COVID-19 infection with subsequent marked elevation in autoimmune markers of Hashimoto thyroiditis. So a unique aspect of this case is revealed by a random thyroid biopsy sample, which did not indicate the typical lymphocytic infiltrate most commonly seen with Hashimoto thyroiditis. So the above suggests a complex pathogenic mechanism with mixed component of inflammatory and destructive thyroiditis. And it would be interesting to see what research can be done, further research can be done to understand this mechanism better. Thank you.